Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Dr. Larkin, thanks so much for joining us today. We want to talk about oral health and dentistry as it relates to the SARS-CoV-2 virus. The first question I really want to talk about is the move to an emergency-only essential care mandate. With medicine in general, we're eliminating office visits and anything that's going to potentially spread this virus. Tell me how this is affecting dentistry.
Yeah, thank you so much, Matt. I've been listening to your daily updates, and it's just extremely valuable for the general public to get this level of information. I was really anxious to talk about the dentistry part because in its most basic term, they're telling people to wash their hands and don't touch your face. And I'm thinking, well, the next transmission is through your mouth or through your nose. We're not completing the story. And so the mouth has a part of this, right? So the transition to the emergency-only model, the dentists are really scrambling. I can talk a little bit about what I'm doing in the practices that I manage. The biggest issue that I've had is the speed of this, right? I knew this was coming, and we've been talking about it for weeks. And we had an all-office meeting planned for April 1st, and it's just like, wow, it's been all hands on deck for about 3 or 4 days. So this emergency mandate to an essential only says, emergency dental care. We can't have the ERs overrun with toothaches and swollen jaws and stuff like that. The problem has been for all the dentists that I'm involved in. So I'm a faculty member on a closed message board of about 1,000 dentists, and then participate in a variety of groups that may total 20,000 dentists. So I see what's going on everywhere, right? And there's a lot of panic and there's a lot of angst, and what it comes down to, what is essential care? So or non-essential care. So non-essential care would be cosmetic dentistry, orthodontics, implants, those kind of things. But now we get into essential, and I'm going to talk about periodontal disease in a minute because you and I have chatted before, and we've had really good conversations about the oral systemic connection, and I want to talk specifically about COVID-19 and pneumonia in just a second. So that has been the issue. So what we're doing, I can just talk about our practice because there's no real playbook on this, right? This is an epic event, and so we're doing social isolation by having people text us when they get to their car and come in individually, right? So we're talking about really slowing down the office flow, okay? And this is both in the work that we're trying to finish and the emergency type things, right? We've got 3 doctors, maybe 15 employees. We've broken up into teams, so we don't want everybody ever together in case someone gets an exposure. Then the whole office closes. We're putting those people into shifts, and so worst case scenario, a shift may go down. Infection control. Everybody's getting their temp, pretty much the standard stuff, the temps, the disinfection. The big issue in dentistry, and this is really why so many people have closed down to a cold stop, is aerosols. And I sent you an article about aerosols, and this is something that I've been talking about forever, and it just became real and topical to dentists today. So in the course of our daily work, we use various instruments that create fine aerosols. and the mouth has over 700 bacteria and about 12 or so pathogens. And so those are put into an aerosol into the room, and they're infectious. And, in my practices that I coach, we use a microscope to look at biofilms. And one of the most hazardous professions out there is the dental hygienist, because she will pick up the biofilms from some of the nasty mouths that she has worked in. So that's something that I've been aware of for a long time. So this is not an issue in most of the offices that I've coached, because we use antimicrobials in water lines, and I have offices that are using ozonated water, and I want to talk to you specifically about that, because we're shifting to a closed loop ozonated water system next week as quickly as I can get the equipment, because that's the solution. So tell me, do you have in your work, you guys doing anything with ozone gas, ozonated water?
I'm actually supposed to record a podcast with Dr. Matt Cook on this in the very near future. We just don't have it scheduled yet. So he's a big proponent of this. I've talked to him about it a lot, and we're not using it yet.
Okay.
I'm still digging into the evidence for it, but tell me what you know and how you're using it.
Yeah, so it's been around a long time, and I've been seeing it at the conferences for years. And when I've done my research on the web, I've never felt comfortable with the resources. Some of the practitioners were a little sketchy, and I knew that the basic technology was solid, but so basically it's three forms: ozonated water, okay, where you actually use a diffuser and just saturate water, and it's a fabulous antimicrobial, and I'll talk exactly why it fits so well. Then there's ozone gas. Okay, now that's where you're going to have some training. So in dentistry, it's been used for disinfection, like in root canals, for gum disease, but it's very hazardous. You should not inhale ozone gas right out of the dispenser. And then the third thing that is a little bit intriguing to me, and once again, I've been exposed to it years back and didn't pay attention. There's a lot of things that I know that I don't want to say I ignore, but they just weren't important, that are important today. And I'm sure that's happened to you, right, in the last couple of weeks. And that's ozonated oils, okay? So when you put ozone in oils, it's very stable and it's very long lasting. The issue with ozonated water in the dental office is shelf life. So it's a half-life. You may have to prepare it once in the morning, fill the water bottles that administer the dental instruments, and then do it in the afternoon. Not a big deal, right? But it's technically sensitive, right? So it's fabulous. Antiviral, antibacterial, antifungal, all that research is out there, okay? Ozonated water is really a simple solution. Now, the main reason that I'm such a big proponent of it, as opposed to the antimicrobials that we currently use, if you put chlorhexidine, sodium hypochlorite, and I'm going to talk to you a little bit about traditional dental stuff, they're corrosive, okay? They're going to gum up your instruments, your ultrasonics, and you're going to have to rely on the fact that your personnel are doing the proper flushing of the water lines and stuff. And you know how people are. People forget to do stuff, right? And instruments get gummed up. So ozonated water solves that issue. It is not corrosive, and so any aerosol that's created, you're killing viruses and killing bacteria. There's no issue at all. So that's a.
Hey Tom,
yeah.
Just to clarify, the ozonated water and then potentially oil, which we're going to talk about, that's for sterilizing your equipment. How are you using that exactly?
So those are coolants. Okay, they would be used as a coolant. So when we use a dental drill, there's a water that's generated, right? And I got to say, most of the offices in America, the water it's tap water, right? That actually cools the instrument. The one that has really caused offices to close is the ultrasonic instrument. I don't know if you've ever had your teeth cleaned with one. It's kind of a high frequency vibration. It's very efficient in removing biofilm and tartar, and it generates water, but it generates it in a very fine mist that becomes airborne. Okay, so that mist, if it's used with tap water, will generate a pathogenic biofilm. Okay, through the room, right? And that's the danger. Now, no one's cared until last week. So, and I've lectured on it for years, right? And that's kind of the thing. The oils are something. It takes a little bit longer to ozonate oils. I've seen the technique. It's something you can take home. It's stable, right? So, and once again, you're not going to find evidence. And I know how important evidence-based stuff is to you, and it is to me too. And I don't like to talk about anecdotal things, but at this point in time, what the heck? I mean, I'll tell you that I personally have purchased some ozonated olive oil with zinc. Okay, and all of the anecdotal stuff was it's great for herpetic lesions on the lips. Well, I cannot, in my own mind, see the harm in using that as like a lip balm right now. A couple of times a day, put a little olive oil with zinc and ozone. Okay.
Tom, and I've talked to Dr. Cook about that, and I think from what I understand, you basically would just bubble ozone through the olive oil, and that would basically ozonate it. Correct?
Correct. It takes a little bit longer than water. So water preparation takes about 25 minutes. I think to do like a half a gallon, and oil I think takes considerably longer, but it's more stable, right? So I think that's interesting, right? At this moment in time, that's interesting to me. So these are the moves that we're making in the short term, and we're able to respond. We don't have to close. We can go into an emergency model. It's important to me because I met over the internet with the team yesterday, and I see people with just tremendous distress. And we're keeping our team together in a reduced fashion. I think it's important going forward. I don't know what next. We may be closed next week. The CDC may close up completely. But that's going to add an extra burden to the emergency room, because my main doc, when he was a resident, covered the emergency room at UK, and the dental emergencies that come into UK, they can't have that right now, right? So there needs to be that level of care out there.
So what can dentists that are practicing right now, what can they do tell me a process for being able to take care of emergency cases, but minimize transmission and contagious.
The transmission,
minimizing infection.
Yeah,
minimizing infection and spread.
They have to get their water situation down immediately, or they're going to have to close. I mean, I hate saying that. That's going to be really. Some people in your audience aren't going to like that, but they're going to have to if they have nothing but tap water in their office and they're not addressing it, then they're going to have to retool, right? I don't see any way around it. I mean, and that's why a lot of the hygienists have been laid off, because they know they don't have a solution for that, right? So that's why I'm super busy right now doing podcasts and saying, listen, here's the model going forward. I can't save you this week, but I do have, and we'll talk about this, toward the end, I have a whole set of guidelines that I'm working on for kind of after the wave. I think we got a wave coming up here, in the next month or two, and then we got to look at what the new normal is. I think you would admit we're not going back to life as normal. I think this thing is going to become endemic, right? Part of the seasonal cocktail, and then we pray for the vaccine and some other antivirals.
So when you say get their water under control, what do you mean exactly? What can a dentist do today?
You're going to have to find some system that you use an antimicrobial in your water system somehow, right? Stop using tap water, right? That's a little bit, there's different types of water supplies in the dental office. Sometimes the chairs actually have an individual bottle. That's pretty easy to do. You could put an antimicrobial in the bottle, but some are just connected directly to the city water. Okay, there's a risk there, right? And that's why offices are closing.
So I'm going to give your information for dentists to reach out to you if they have questions and want to try to implement these things. How can a cosmetic dentist, someone who's doing orthodontics who may not have any work in the near future, what could they do to help? Is there a role for tele-dentistry?
Yeah, so that's really the first thing. And once again, this has been on my plate for a couple of years. Yeah, we'll get to it. I have a long list of projects, right? And then all of a sudden, the sense of urgency, I looked at it and it didn't make complete sense to me as much as it's 100% for you, right? It makes total sense. But I'm like, well, dentists have to work on people, right? So we just immediately went to, took 2 or 3 days last week to get our practices, and just we cobbled it together with Zoom. Okay, there's some apps and there's 2 or 3 things, but I want to make it real simple. And I have told a lot of people that All the HIPAA regulations regarding telehealth have been waived. I have the documentation for that. So you don't have to worry about, that was the thing that was slowing me down last week, was going through all the HIPAA platforms. And so you can use Zoom or Skype right now for the time being. The most important thing is our relationship and reaching out to our patients right now, reassuring them. And that's why I want the doctors to be able to see them face to face for any follow-ups. And we're going to probably do a lot of free consults, right? What are your concerns? Just kind of like a triage, right? So we're opening that up to any patients of record and any new patients that, find us over the internet. You want to just chat for a few minutes and say, what is it that you're doing infection control wise that's different? What is it that you do, bacterial testing? What are these pathogens? And we'll talk about the pathogens in a minute, but that's an important avenue. And I'm sure right now it's absolutely mission critical to you.
So, Tom, what can a dentist do right now who is practicing? They're seeing emergency only patients. What can they do to kind of get their water supply in order? And just walk me through the steps.
Okay.
Like 4 or 5 best things, like the one person at a time.
Right.
What else can they do?
So I've created a landing page on my consulting website with all the information on how to get set up strictly for ozonated water. I wanted to really simplify it so that, because I don't want you to get lost in the usage of the gas and the oil. We just need to get a high quality anti-infective water system in place immediately. And that's the quickest way to do it, right?
Great. So what are the other protocols? So one person at a time, let's use ozonated water. Anything else specifically that other dentists may not be thinking about?
Yeah. So on check-in, taking their temperatures, antimicrobial hand wrist when they come, when they check out. Let's see. Yeah,
Are there any, is telemedicine, is tele-dentistry an option for people? Right now, I know there are going to be a lot of dentists who are probably have skill sets that haven't been used much in the past, and now because they're practicing cosmetic dentistry or orthodontics. Could they help? How can someone easily provide teledentistry?
Absolutely.
What's the state of teledentistry?
Yeah, so absolutely. So one of the things that happened recently is that the HIPAA compliance regulations have been waived on telemedicine temporarily. So Skype or Zoom are appropriate. I recommend face-to-face visits, even if it's a follow-up. If you're an orthodontist and you want to do some follow-ups, you can do a lot over the internet. And just reassure your patients and engage patients, right? And kind of help them the best you can, but face-to-face. That's what I would do.
Great. So I'm going to refer people. What is the website where people could talk to you, other dentists, about teledentistry and the ozonated water?
So it's powhygiene.com, POW hygiene.com, and it stands for Proactive Oral Wellness, and that's where they can find everything about what I'm doing.
Now let's talk to patients specifically. If your teeth are a little crooked, maybe just hold off for now, trying to get those straightened.
Sure.
Other cosmetic things, just put on the back burner.
Absolutely.
But what, first off, can we do to prevent having these dental emergencies? Just kind of some at-home simple things that most people do not do that are going to make the biggest impact.
Let's talk about home remedies. We're all kind of in a little bit of a lockdown right now, and let me just talk about tried and true long-term anti-infective. Because what we're talking about is a pathogenic biofilm. If your gums bleed, you have an issue. And having periodontal disease and getting COVID-19, that is a pathway to pneumonia, okay? And I sent you quite a bit of research on that. I know we don't have time to talk about it, but that's the issue. So in the short term, hydrogen peroxide and baking soda, specifically not over-the-counter hydrogen peroxide. There's a peroxide called Peroxyl, Peroxyl. That's an oral hydrogen peroxide. I think it's 3%. Mix it with baking soda, okay? These are fabulous antimicrobials, okay? And make that into a mixture. The other thing that you can use, and I don't recommend this for patients in the office, but I do it personally, is Clorox. 1 teaspoon in 8 ounces, and I put it in a water pick, okay? The reason I don't recommend that to patients in the office is because they get alarmed by the word Clorox. But that is a very safe antimicrobial, inexpensive, and it works, right? So those are a couple. I would get rid of your toothbrush right now and get a new one. I would probably change out your toothbrush every 30 days right now. unless.
Why would you do that, Tom? Explain.
Well, it's just full of bacteria. Okay, we're talking about bacteria, viruses, funguses. That the conventional, unless you have like I've seen people that have like a UV light where you can put your toothbrush, and not too many people have that. Or if you put the toothbrush in the sodium hypochlorite and completely disinfect it, I mean, those would be options. Most people don't. Most people use an over-the-counter toothpaste and just put the toothbrush down, and there's bacteria on that, right?
But assuming you're not passing that around to other people, it's your bacteria, correct? Tell me why that is a problem.
You probably got pathogens, right? You're re-inoculating yourself. Yeah, we're trying to clean this up. We're trying to shift the biofilm to a more healthy balance, right? And most people, I've looked at a lot of them. They don't have a healthy biofilm.
Is there an at-home solution or recipe that you could give people that they could kind of somewhat sterilize their toothbrush with?
That tablespoon of Clorox and 8 ounces of water, before you rinse with it, and once again, don't ever swallow this. But I would put my toothbrush in that and then stick it in my water pick and then use it with the water pick.
Great. Yeah, that's helpful.
Yeah.
What other things at home should people be doing to focus on their oral health?
Those are the main things from an anti-infective standpoint. I know yesterday you had a podcast on nutrition and you went over that in a really, really good manner. We just have to kind of take care of ourselves in this downtime. My concern is that if everybody gets locked up for 30 days, we're just going to be eating pizza and bonbons, from the stress. Yeah. Unless there's a national bonbon shortage. Exactly.
I don't want to create a panic by
exactly
suggesting that. So let me summarize and see what else you think is important. Then I'm going to point people to your website for more information. For dentists, you really got to get the wider situation under control.
Yeah.
And your website has more information on that.
Yes.
Other things at the dentist's office is let's just be smart about our protocols. One patient at a time. You're not moving from patient to patient,
right.
Potentially spreading infection.
Right.
Emergencies only. There's no reason to put yourself at risk
right.
of catching SARS-CoV-2 for cosmetic reasons. If dentists, and I know that's going to have a negative impact on a lot of dentists, but we're all kind of facing negative economic
it's equal
impacts right now.
The pain is equal. Yeah.
Yeah. So we do have to come together, and if we can share information on tele-dentistry, it seems to me that there is a supply of dentists out there. The telehealth solutions are pretty good, and the HIPAA compliance is being loosened at this time. So if people wanted to learn how to do that, is there a good resource or a good way people could get started with tele-dentistry really quickly?
I can help them on that, and I've got the different apps. I don't have it in front of me, but there are 2 or 3 apps right now that are already been developed for dentistry. So basically what I have, the ability on our websites, is the ability to upload a picture too. I think that's important. So we have a form. You can upload pictures, send it to the office, then we'll set up a Zoom meeting and just kind of chat on whatever's there. But I think it's important to be the ability to be able to upload images.
Perfect. And then for just people out there, you really want to focus on your dental health, because you don't want to have a dental emergency and end up going and needing care somewhere where you're around other people who can't practice the social distancing. So using soft picks, the peroxyl and baking soda mixture. Now a specific recipe for that. Is that easy to describe right now?
Yeah. There's no real recipe. I mean, you can mix it together into a little slurry, or you can just take the baking soda out of the box and put it on your teeth with a toothbrush, and then put a cap full of the peroxyl in your mouth and just kind of swish it around. And I'm glad you mentioned the soft picks, because that's part of the protocol. Take a soft pick and work that slurry in between your teeth. And you just want to make sure that at the end of the day, when you spit that out, there's no blood. If you spit it out and there's blood in that slurry, you've got periodontal disease and you got an infection, right?
So you spread the baking soda with the toothbrush on your teeth. You use some of the peroxyl rinse, and you use a soft pick. So someone just Amazon's soft picks.
Yes.
It comes up what you're talking about, correct? Yeah. And so that would go between the teeth. Make sure you get the solution between the teeth as well.
Right.
And then to sterilize a toothbrush, you think the best solution is a teaspoon of Clorox and 8 ounces of water to sterilize a toothbrush?
I think that would be a good antimicrobial to keep your toothbrush clean in the meantime.
Well, all that, it sounds incredible. I know you could talk for hours about this. This is what you do. You're the expert. So, but if people do want to have a longer discussion or see more resources, it's powhygiene.com. Is
Correct.
That correct?
Correct.
Well, anything else you think is super important to get out right now?
No, I think that's the main thing that I was really anxious to let people know is that there's an oral component to this. And I think your ultimate outcome, when they talk about the patients that are high risk, I do not think it's age only. I think you could be young. I didn't have a chance to talk about sleep apnea, obstructive sleep apnea, but my feeling is that if you're 40 years old with rampant periodontal disease and sleep apnea, I think you're in the high risk category. I don't think the oral component they just haven't had the time to define it. So why would a 40-year-old that gets this die, right? And I'm pretty sure they have some of these other components. So there needs to be a much more comprehensive picture of what this is, because there is an oral component to this.
Yeah, but it's just like good nutrition, though. Focusing on good oral hygiene is never a bad time to do that, and it's probably more important than ever right now. So thank you so much, Tom.
Absolutely.
We'll get this up very soon, and then if anybody asks us, we'll refer them to you for more questions. If you're listening in and you have more specific oral hygiene questions, share them on our Instagram at Wild Health MD or the Facebook page, and we'll get Dr. Larkin back on again to answer those questions.
Outstanding. Thank you so much for your time, Matt.
Thanks, Tom.
All right.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.